It is very common for babies to be fussy and nurse very often in the evenings, sometimes during the day, particularly in the early months of their lives. The worst part is that it may have happened when things were beginning to go well for you. Your little one was nursing every couple of hours or so. You as a new parent were starting to understand their feeding, sleeping, and playing patterns, and it felt like you were getting the hang of things. You felt good knowing their routine and being able to anticipate what they were going to do next. If you realize that suddenly things have changed, and your baby has started feeding much more frequently, chances are your baby has started to cluster feed. While every child is different, most newborns will nurse every 2 to 4 hours and get around 14 to 17 hours of sleep per day. But, when cluster feeding begins, it can completely change this typical nursing pattern, causing you to become more tired and sleep-deprived. During this period, which often occurs in the evening, but can sometimes happen during the day, your baby will feed much more often, sometimes as frequently as every half hour. In addition to feeding more, your baby may also become increasingly fussy. While things might feel overwhelming and extremely tiresome during this new stage, cluster feeding is perfectly normal. These extra feeding sessions are helping your growing baby get the nutrients and calories they need for their development. There are several reasons behind why babies might suddenly start nursing more. Here are the top 3 reasons. 1. Your baby is going through a growth spurt. The most common reason for cluster feeding is that your baby is going through a growth spurt. While the specific periods of growth spurts may vary, a baby will typically experience growth spurts at around 1 to 3 weeks, 6 weeks, 3 months, 6 months, and 9 months of age. Cluster feeding during any one of these periods of your baby's life is understandable because, as your baby grows, their nutritional needs will naturally increase. Your baby will need more milk, as the milk they used to find satisfying at 3 weeks won't be enough at 3 months of age. 2. Your baby is nursing for comfort. Sometimes your baby isn't going through a growth spurt or trying to fill up. So, why do they continue feeding? They may be comfort nursing, since breast milk has properties that can offer relief from pain. And if your baby is tired, comfort nursing can help your baby relax before getting a good night's rest. 3. Your breast is producing a reduced amount of milk supply at night. While cluster feeding can happen at any time during the day, it commonly occurs during the evening or toward the end of the day. This is because breastfeeding moms often experience a drop in their milk supply later in the day. Naturally, this will mean your little one's feeding sessions won't be as satisfying as they are during the day. So, your baby may need to feed more to get full. Cluster feeding may not be the most comfortable for you, but we hope you understand that this is perfectly natural and will soon subside. Your little one needs you right now. We have 4 tips to help you cope with cluster feeding. 1. Don't be so hard on yourself. If you were planning to exclusively breastfeed for a while, know that cluster feeding is actually helping you produce the milk your baby needs, and reducing the amount of nursing time could decrease your milk supply. So, start by giving yourself a break. You didn't do anything wrong. There's nothing wrong with your milk supply. 2. Eat often and make sure to stay hydrated. Cluster feeding can be physically draining to breastfeeding moms. And sometimes, as a mom, it can be easy to forget about yourself. But the truth is the more your baby nurses, the more energy you need. So, it's essential to take care of yourself. Make sure that you always have some water and your favorite snacks nearby so you can keep yourself well hydrated and nourished and get the energy you need during and after feeding sessions. 3. Consider different feeding positions and wearing different clothing. Comfort is one of the key components in helping improve the way your baby's feeding sessions go. Ensure that you wear practical, easily accessible clothing, like nursing bras and loose clothing for both you and your baby. 4. Don't be afraid to ask for help. Sometimes mothers want to do it all by themselves. But you don't have to go through this alone. Ask for help from your loved ones. Lean on their support to give you the strength you need to make it through this time. Cluster feeding won't last forever. Remember, most babies might cluster feed for a couple of days, and some up to a few weeks. So, just hang in there. Hey mom, tell us how you coped when your baby started cluster feeding in the comments section below. And thanks for watching Tiny Tribe Parents. If you could please help us out by hitting the like button, commenting and subscribing to our channel for more incredible content that is on the way.